Assalamualaikum warahmatullahi wabarakatuh. Okay, thank you. Thank you to all professors, associate professors, doctor, brother and sister for joining this first KAHS pitching talk. Okay, so before we start our pitching talk, let me introduce you about the speaker. Dr. Ahmad Aidil Arafat bin Dzulkarnain is an associate professor at Department of Audiology and Speech Language Pathology, Kuliah of Life Sciences, International Islamic University Malaysia. He obtained a degree in Bachelor of Audiology with honors from University Kebangsaan Malaysia, UKM, in 2003 and received Doctor of Philosophy, PhD in Audiology from the University of Queensland, Australia in 2008. He is currently the Dean of Kuliah of Life Sciences, IUM. He was the head of Department of Audiology and Speech Language Pathology from 2012 to 2013 and the Deputy Dean of Postgrad and Research of Kuliah of Life Sciences from 2017 until 2021. He has been the visiting academic at the University of Queensland, Australia, and visiting scientist at National Acoustic Laboratories, NAL, Australia, both in 2013 until 2014, respectively. As a scientist, Dr. Aidil has substantive research work in the area of auditory neurophysiology, specifically in the auditory evoke response. His recent research is concerning evaluation of sound cognitive and emotional therapy intervention using AER tests among patients with special needs, such as autism, spectrum disorder, and attention deficit hyperactivity disorder, or known as ADHD. This work is fully funded by the Ministry of Higher Education of Malaysia through Transdisciplinary Research Grant Scheme, TRGS. He has authored and presented more than 100 papers in both international, local journals and conference. He has also interest to improve the audiology teaching instruction and has done few studies in translating some of the audiology teaching to become a simulated teaching. Dr. Aidil has published several quality papers, including systematic review, in prestigious local and international journals, and at the same time serve as regular journal peer reviews. Due to the recognition in his work, especially in the auditory neurophysiology, he has been invited as either keynote or professional trainer by either government or private agency, as well as the Audiology Professional Society in Malaysia. Recently, he has been awarded by IUM as the most promising academic health sciences based on his significant contribution to IUM in general and audiology in Malaysia specifically. Without further ado, I would like to invite Dr. Ahmad, Associate Professor Dr. Ahmad Aidil Arafat bin Dzulkarnain to present his talk. The floor is yours, Dr. Aidil.
Thank you, Dr. Hafiz. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh to all of the audience. Thank you for spending a time to listen to my pitching talk or some sharing about the systematic review. I would like to share my slide. Everyone can see my slide? Boleh, Dr. Hafiz? Okay, good.
Yes, sure, yes.
Okay, so inshallah today I'm going to talk two aspects of review papers. So systematic and scoping review, very brief because the sessions like a pitching talk is very concise. I'm not going to talk in detail specifically on how to actually do it, scoping review or systematic review, but my aim is that to enhance some of your understanding, perhaps to to know more about what is actually scoping review as well as systematic review, and to give some tips to conduct both scoping review as well as systematic review using a one single database search. So this is something that we're going to talk after this.
But tadi the slide.
Oh, kenapa? So,
Please, so can you present the slide again? Thank you. Now we can see your slide.
all right. Okay, so first, maybe we should define what's actually a review paper in general. So basically, the functions of a review paper is to summarize the current states of understanding in a particular topic. So I think that is one of the reasons why we actually write or publish a review paper. So we aim to summarize the current understanding on certain topics or of area of interest. And we intend to synthesize findings from the literature, in particular from the core papers. So when I said core papers, is a papers that perhaps play a significant contributions to the certain area of study. And from the synthesis, we intend to produce a more solid argument. Or maybe in very simple term, we try to actually take the findings from multiple single studies, and we try to actually combine all of the findings to come up with certain solid conclusions. So I think that's the aim of the review paper. Sort of like we try to combine all of the papers to come up with a good arguments or proper understanding on certain topics. So in general, there are a lot of types of review paper. And I just highlight today's in this presentation or the pitching talk on three types of review paper. So first is scoping review. Second one is systematic review. And the third one, narrative or literature review. Or maybe there are certain other terms that are being used in the literatures that perhaps pointing towards the same methods or the same types of the review paper. So if we're talking about scoping and systematic review, they have certain types of framework that we need to follow, certain types of methodology. So people would say that this kind of review are more rigorous and people can actually replicate based on the structured methodology. So that's why in academics, perhaps this is two types of review that normally being accepted in the academic world. And not to say that narrative or literature review are not as good as those two, but somehow there are certain limitations in the narrative and literature review. For example, like the flow of the way we actually write the narrative or literature review somehow is biased towards our perception. And this is similar like postgraduate students who actually write a thesis and write the sections of literature review. There are no actually a systematic or clear way on how you should actually write the literature review, but somehow you are actually using your perhaps your own experience or the guidance from your supervisor to come up with a well-structured literature review. But there are no methodology, a clear methodology that being used in narrative or literature review. So that's why most of the time, if you are targeting a high impact journal, they are inclined towards either scoping or systematic review. So in this talk, I try to actually share with everyone, so what is actually the difference between these two types of review? And perhaps in the future, you can have a clear idea whether you should actually proceed with a scoping or a systematic review. Okay, now we start with scoping review. So the original ideas by scoping review has been actually discussed as early as 2000, year 2000, and the first established protocol is in 2005. So actually the aims of a scoping review to provide an overview, general overview of available research evidence. So it's not intended to provide an answer to a narrow types of research question. This one we're going to talk after this. So what does it mean by a discrete research question or a narrow research question? And normally we will conduct a scoping review before we conduct a systematic review. So we provide the overview of the evidence After we provide the overview of the evidence, then we proceed with the systematic review. So systematic review, on the other hand, have a very discrete, very narrow research question as compared to a scoping review, which are more general and has more broad perspective or research question. And same point that I mentioned earlier is using a rigorous technique to summarize the relevant literature using a proper framework. And scoping review typically does not have a research question, ataupun or maybe it have very broad research question. As I said, systematic review, on the other hand, it has very narrow research question. So I try to give example in this particular slide on what is actually the research question for scoping review and what is actually the research question for systematic review. So if you can see my slide here. So the first one, what is the current understanding of providing feedback among health sciences students? So this is a scoping review, very broad, because what happened, you would like to get the literatures that related to providing feedback. Providing feedback is something like a teacher or lecturers who give feedback to the health science student. So you would like to know, based on all the available literature, what is actually the findings that they have related to this particular topic. So what they actually mentioned in the literature on this particular topic. So that one is scoping review. But if you have a really narrow research question, for example, the second one, do students who being provided with clinical feedback perform better clinically than students who are not? So this is very specific because you are trying to see whether the students who have been given feedback in the clinic, for example, like in our case in health sciences, some of us go to clinic, so go to audiology clinic, optometry clinic, for example. So some students in the experimentation perhaps has been given a feedback, some are not being given a feedback, perhaps in the experimentation. So we would like to know whether by giving a feedback will translate it to a better performance among students. So that one is very narrow, very specific. You would like to know the intervention, the clinical feedback, whether it can actually cause some sort of effect to the students. So this is suitable for a systematic review because it's very narrow. Okay, so the findings from the scoping review can actually lead to a multiple systematic review. And then again, like I mentioned, the main objective of scoping review, besides to synthesize, is also try to map the current knowledge. Maknanya what is actually the available findings. We try to actually come or analyze all the papers, try to see the similarities across papers, and try to see the differences across papers, and produce certain themes that we call as themes. And then later on, we will make an argument, solid argument, identify the research gap in this particular area. So that is actually the aims of scoping review. And scoping review are more flexible in terms of the papers. You can even include a conference paper, magazine, even a review papers itself, proceeding or grey literatures you can actually include in the scoping review. As compared to systematic review, it's actually more specific. You need to actually filter. Normally, we only accept those papers who are peer reviewed, have high level of evidence, and even we will actually do some rating, that what we call as quality appraisal. And like I said, normally we will do scoping review before we proceed with the systematic review. In fact, in certain countries, they are asking the applicants for research grant application to do scoping review before submitting the grant application. And perhaps this is something that we can actually put as an habit among our researcher, maybe to write a scoping review, give a clear understanding about scoping review, and later on submit the grant application, and later on perhaps you can actually publish a paper from the grant application, regardless whether the grant or the research grant has been accepted or not. And the final products of the system of the scoping review is the themes. Kita panggil themes ni is the findings that you obtain from the literatures. If you have 40 papers, maybe half of them are talking about certain team. Maybe 25% out of that paper is talking about certain team and 25% talking about certain teams. So that is something that we're going to highlight in the systematic or scoping review. Okay, so this is the function of scoping review. First, to identify the knowledge available, establish the knowledge that has been established, and then identify where finding maybe have a solid finding but not really clear, not very definitive. So this is also something that we can actually use using scoping review. Identify the gaps, and then we also can suggest in the discussion section where should actually the new research should be directed. And this is following the guideline or framework of the scoping review. You will actually some sort of extract the information from the papers, each of the paper, in terms of the timing, in terms of the location, in terms of the type of the papers, peer review, for example, and certain type of intervention from the papers. So there are certain guidelines provided by the scoping review framework, such as JBI, for example. They have certain types of guideline on what kind of information that you can extract from the papers. And we can actually clarify the working definition. This is also one of the good thing about scoping review. Maybe there are certain definition that has been used in different papers. You can actually clarify that certain papers using this type of definitions, actually they are referring to the same thing, but actually using certain types of abbreviations or terminology, which is actually focusing on the same aspect. And again, the last one is to determine the possibility to conduct a systematic review. So this is some framework of the scoping review. If you can actually go to the Google search, perhaps you can actually find a lot of framework for scoping review. The most popular one is the first and the third one, JBI and O'Malley 2005 framework. Okay, so basically all guidelines in general have these following types of information. First, in terms of the guideline to search for related studies, how you should select the papers, how you should chart or map the evidence. So this is the point I mentioned earlier. You need to come out or extract information about the authors, the year of publication, sample size, study population, general methods, general methodologies, type of intervention, and the key finding. And the key finding later on will be analyzed or synthesized, and we need to obtain something that we call as themes. And some publication they use a risk of bias, but recently I have attended a KBI workshop, so that said that they're not actually encouraged to actually put or to include risk of bias, but perhaps it is something that we can actually discuss further. Maybe some of people would actually prefer to have this kind of assessment, but in general, why actually some of the experts try to eliminate this particular risk assessment is because, like I said, scoping review are more broad and it's more flexible in terms of accepting papers. So if we are assessing the quality of the papers, perhaps it could actually defeat the purpose of the scoping review. Okay, this is extra reading and extra talks that you can actually go through. This is some example. I'm not going to go to these particular papers. Maybe if I go to, maybe later on after I finish the talks, because I be only given 30 minutes. Okay, the limitations of scoping review: lack of quality assessment. Actually, we need to rate the quality of the papers, but this is not happen in scoping review. It's only happen in systematic review. And like I mentioned earlier, selection of paper very broad. So magazine you can include, conference paper you can include. So in general, it may actually cause some sort of like limitations in terms of the scientific evidence of the scoping review. But again, we need to remember scoping review, the aim is to provide an overview or the current knowledge of certain topics. So we try to exclude the quality parts. If you're talking about quality, we are actually moving towards systematic review and lack of proper data analysis. So if we are conducting a systematic review, yes, we need to have a proper data analysis. We need to have like meta-analysis using effect size, for example, and we can also use some descriptive analysis, which is more proper as compared to in the scoping review. And obviously, because of this limitation, it cannot be used to adopt as a policy or decision. If you have a scoping review, we cannot actually tell based on our scoping review. This is the finding that we have. So because of that, Malaysian government or certain agency, you need to actually take this finding as part of a decision or to make a policy. So that is about scoping review. I hope I can provide the understandings about this particular review. Okay, the next one is systematic review. So systematic review is a summary of literature, particular topic, and it actually produced by a systematic search and being systematically analyzed. And we need to follow a certain protocol. There are a lot of protocol available. Cochrane have their own protocol. Prisma have their own protocol. And you can actually follow which one protocol that is good and available. And certain journals, they are actually very strict. You need to actually focus or use their own preferred protocol in order for them to publish your paper. So because of that, somehow you need to be really careful in terms of selecting the framework that you're going to use for your systematic review. And normally, systematic review, they have specific research question, very narrow research question, and it comes with what we call as PICO format. PICO format is stand for participant, intervention, comparison. Comparison. I think there are 4 elements: participant, intervention, comparison. And it's a popular analysis for evidence-based research in medicine, health, and nursing. And normally, to know the effectiveness of certain types of treatment, drug, for example, drug treatment versus placebo, we are using systematic review, using a systematic analysis to know whether the drug is really effective or not. And research systematic review is normally deal with effectiveness or comparison. So basically, it's very, very narrow, specific. You are comparing something to something. And it can be done using evidence that involve either quantitative only, qualitative only, or mixed method. Mixed method means you combine between quantitative and qualitative data, but somehow you need to use certain types of assessment tools that are suitable to judge the quality of the papers using a qualitative or quantitative or a combinations of quantitative and qualitative. And like I highlighted earlier, it is recommended to do scoping review beforehand and publish before we actually proceed with the systematic review. Okay, so this is an example of some research question. Okay, in this particular example, what happened is that this study tried to establish if there is evidence available in the literature to show that the simulator training can be used among nursing students. Example, can the simulator training cause the student perform better than non-training group or at least equal with a traditional training group? So there are 3 elements that we can see from here. Okay, the first research question, do SLE. SLE stand for simulation. Simulation trained student in nursing education demonstrated increased knowledge acquisition and or clinical skill compared to untrained students. Okay, so basically the one that I underline, SLE, trained students, I would say this is the 2 aspects kat situ, is a participant as well as the intervention. So the intervention is simulation, students is actually the participant, increase is actually the comparison, and untrained student again is actually the control group or the participants. The same one, the second one, do SLE or simulation trained student in nursing education demonstrate the same or increased knowledge acquisition and or clinical skill compared to traditionally trained student. Okay, the same research question except for the control group is actually different. So basically there are elements of the PICO research question that I actually mentioned earlier. So how to get an understanding, to select a topic to conduct a systematic review. So first is by having your own scoping review. And then other people's scoping review, you can actually check if the people have write a scoping review. Somehow, if they are kind enough, they might mention some potential topics for a systematic review. And and sometimes when you look into the themes or finding from the scoping review, they actually might highlight certain potential topics. But this is not direct. You actually need to do some structured thinking to actually pick up the potential topics of systematic review. And somehow from your own experience as well, as a researcher, you can also formulate a research question as well as how or topics to conduct systematic review. Example, maybe you have do some studies to compare effectiveness of certain types of intervention over a certain control group. And at the same time, you also know there are a lot of other studies that has been published in the literatures that looking into maybe the same perspective. So now what happens is that you want to combine the findings from the previous literature as well as your own finding. You want to know whether the intervention, like in this example, X type is better than the control group. So that is a good start for you to actually conduct a systematic review. So the good thing about systematic review, it's eliminated research bias from selecting only studies known to the researcher. This is somehow happen if we write a narrative review. Normally we will only use evidence that are available and also known to us. And while ignoring, not really ignoring, but perhaps, because you not actually do really thorough search of the literatures, you tend to actually neglect some of the articles. And you also will actually focus on the quality of the study. Although I'm not going to talk about this in detail because it is very short pitching talk, but what happened is that you need to use certain tool in the systematic review. Example, cannot remember exactly the names of tool that I used. The short form is CC80 version 12, or maybe now they have more than version 12. So what happened, you need to use certain tool and need to do evaluation towards that particular article. And some of the tool, they will give certain percentage. If the paper score more than 60%, for example, so that is suitable to be included as part of the systematic review. If not exceeding 60%, you should actually drop the paper from the systematic review analysis. And the methodology of the systematic review is very transparent. People can verify, people can replicate. Perhaps this is some issues because there are questions being asked about can we use certain types of database like Google Scholar. Google Scholar is one of the a good database actually to provide a good search for articles, but somehow issues is that Google Scholar change the algorithm very frequent. And what happened, some researchers advise to use Google Scholar only as a part of to find a grey literature or literatures that might not be available at other types of database. But somehow studies, I think there are few studies that have shown that searching through Google Scholar is as good as searching through Web of Science, even as good as searching to certain reputable database. So there are two different opinions on this particular aspect. And the good things about systematic review, as well as scoping review, it might attract high number of citation for your paper. And I give an example like myself, my papers that have higher citation is coming from a systematic review paper. Perhaps not something that you should actually focus on, but this is something that will happen when you publish a systematic review because people tend to cite your paper. Okay, this is to show the level of evidence. Actually, meta-analysis or systematic review is being put as high level of evidence as compared to other types of studies. But obviously, need to use certain types of proper analysis, and somehow systematic review also, some of the articles are not using a proper analysis. Perhaps we should actually not put it as high level of evidence. So a systematic review that being done in really good way lah, that we should actually say it is something that provides the high level of evidence as compared to the other type of study design. Okay, as I mentioned, a lot of guidelines to conduct a systematic review, like Prisma, Cochrane, which you can actually go through. So basically, all of the guidelines consists of the following aspects: research question formulation, like I mentioned, using a PICO format. You need to have a clear inclusion and exclusion criterion. Example, maybe you want to focus on certain type of intervention, and maybe you want to focus on certain year only because you have actually understood that this particular intervention only emerged starting from year 2015, for example, or 2010. So because of that, your search will be limited to that particular year. Okay, then search strategy, you also need to have a clear understanding in terms of keyword. So you cannot simply put keyword that coming from your own head. So obviously there are certain strategies that you need to learn on how to formulate the keywords using Boolean operator, for example. So that is something that you also need to learn. Okay, and then selection procedure from the search strategies. You have database, you have keywords. So from all of the keywords, you need to select all of the article. So once you have select all of the article based on the inclusion criterion, and later on you will do data extraction. This one also need a proper workshop to discuss about this. And the next part is quality assessment, the one that I mentioned earlier. And the last part is analysis. Can be used qualitative, quantitative mix, as well as some people are doing like effect size analysis. Okay, so this is the differences between systematic and scoping review. As I mentioned, systematic, more focused research question, scoping review very broad to get an understanding and overview about the current state of understanding in a particular topic. Methodology, robust in both of the framework. It provides clear background, objective very clear, you need to have a specific question. Inclusion, exclusion criterion, you need to have a proper one for systematic review, scoping review. Normally, we are very flexible because you can actually accept any type of papers, and you are not really rigid in terms of the selections of the papers. In fact, you can accept papers that are low quality. And all of these type of review have their own way of selecting the papers. Systematic review have quality assessment, scoping review no. And the next part is data extraction, data analysis. There are differences in terms of how you analyze your findings using systematic review and scoping review. Scoping review, normally we are looking at the themes, more like a qualitative analysis, whereby systematic review, normally we are dealing with numbers or quantitative. And and discussion, normally you need to provide in details, and you can replicate both scoping and systematic review. Okay, this is maybe the last part of my thoughts in terms of sharing with you strategies on how you can doing one search. Apa maksud one search here is that you have your own keywords, you have your own selected database, maybe 4 to 5 database. So using that one search, you try to actually produce a scoping review, maybe one scoping review, and out of that, you might be able to produce multiple systematic review. Okay, so give example here. In terms of the differences, in terms of scoping and systematic review, the one that I mentioned earlier, systematic review are focused on the peer review papers. Sorry, I think typo error. Both are actually writing the same same thing, systematic review. So I think the first one is scoping review. So scoping review focus on the on the same thing. Actually, I confused myself in this particular slide. I'm sorry. So systematic review is actually focused on the peer review paper, whereas scoping review it focus on more broad inclusion criterion. And then systematic review, you need to have a quality assessment in each paper, and they need to meet certain quality standard. Okay. So what happened? Systematic review and scoping review, there are two key differences. First, systematic review focus more on peer review paper, and scoping review you can accept many types of articles, including magazine, including proceedings. And then systematic review, you need to have a quality assessment using a quality assessment tool, which you are not required to do that in the scoping review. So that this is actually the two key differences. Okay, this table is actually from Prisma guideline. I take from one of the literatures. Okay, what happened here, this is a systematic review. So there are steps that you can actually see from here. So the upper part is identification. So you search the database. So in this example, they obtain 1,965 papers. And then they do a screening. So normally screening very simple. You check the title. And if the title is not relevant at all to the topics, you will remove the paper straight away. And then after screening, so in this example, it leaves 1,981, still many. And then you, after that, you and another researchers, you need to actually sit together. And in some case or in some framework, you need to do it independently, and you need to discuss any differences between these two assessor or reviewers. What happened? You need to check whether the papers fit the inclusion criterion of your study. And later on, in this case, after checking, screening the full text and assess eligibility of the papers, so it left only 46. And out of 46, it there actually do some thorough analysis using a quality assessment. So they reject another 29. So leaving only 17 papers. So this is systematic review. So what happened is that how you can actually combine the scoping systematic review. First, the first one, you need to use a very broad searching criterion and flexible criterion. Maknanya, what happened? You need to, in the search, you need to become more flexible using Google Scholar as well as all the database. So you need to include everything, not only restricted towards a certain journal article. Okay, and then another one is quality assessment. You may need to exclude for the scoping review. So once you have done that for scoping review, you need to go back to the article that you have searched, and then you can actually do the same process again for a systematic review analysis. So perhaps from this exercise, you can actually produce one scoping review. If you have FIP student, for example, one FIP student doing scoping review, for the next batch, you can have FYP students to do 2 or 3 systematic review. Yeah, I give example from here, but I'm sorry because this particular example is related to my field. So the scoping review research question, what is known about background sound and adult hearing aid user, including aspect of aversiveness and interference. So this is the scoping review questions. So from the scoping review synthesis, so what actually being found by the authors, so they found 3 types of themes. First, outcome of instrument. Second, general satisfactions of hearing aids. And third, hearing aid technology. So this is the scoping review finding. So from that scoping review finding, you can actually formulate 3 types of research question. For example, the first one, from the themes of outcome of instrument, is outcome instrument of A better than B. So this is actually one possible systematic review topics. Second one, general satisfaction of hearing aid, is hearing aid A better than B to provide satisfaction to client. So this is another potential systematic review. Okay, the third one is hearing aid A has better speech in noise score than B to overcome the background noise. So this is another potential systematic review research question. Okay, this is another example. So the scoping review research question to understand the current knowledge of simulation learning in health sciences. So from this particular scoping review, the authors found 3 types of themes. So type of simulations, duration of training, and level of simulation fidelity. So from these themes, you can actually formulate 3 types of research question. First is simulation A is better than B or control group type of training. The second one is simulation A provide faster learning process to achieve competency than the traditional training. So this is another potential systematic review research question. So another one is high fidelity simulation provide higher score than the lower fidelity simulation. So this is another types of potential systematic review research questions obtained from the scoping review. So I'm not going to discuss this in detail, but this is actually the framework of scoping review, and this is the framework of the systematic review. So basically they have same like the normal paper, introduction, methods, result, and discussion. And for systematic review, introduction, methods, result, and discussion. So this is my last slide. So it's not easy to conduct systematic review because somehow I got a feedback from from some certain people lah, when they see other researcher actually conducting systematic review, scoping review, they say this is actually very simple lah, and it's not something that is novel or something that is significant to the body of knowledge. So you know, because of that, we should not regard this is as something that is beneficial to the field. So I disagree lah with that opinion. So because I myself have actually conduct myself, and before actually I asked my students to conduct systematic or scoping review, I did it myself during my sabbatical, doing from the scratch, the searching, formulating research question until publication. So this is not easy actually. And if you feel the original research at lab or clinics are difficult, the same thing with the systematic review or scoping review is also not that easy. And you need to be really meticulous, need to be really organized in terms of searching. And I would like to suggest, if you want to embark to the scoping or systematic review, to use certain types of apps that are available, like Covident, for example, so that you will be able to really organize your articles. But obviously, all of these apps come with price, you need to pay. And you also perhaps need an app to generate figure or table. But maybe our engineering partnership from KOE, perhaps they have more expert or they're expert in this particular area. Maybe there are certain way to bypass or shortcut to do this thing. Maybe they can actually share or teach us. And I think the most important thing is to try, cuba tak tahu and keep going. This is most important, kena cuba. If you're not trying, obviously you don't know. And from my own experience, I learn from scratch. Memang betul in that journey tu, there are certain times that I need to actually study and I need to ask an expert, but it's normal. It's a normal process. The same thing like you doing your PhD, and you just try and error, and maybe ask help from other people. So that is actually a normal process. Okay, I think that's all from me. Okay, pass back to Dr. Hafiz.
Okay, thank you very much, Dr. And shukran jazilan to Dr. Aidil. So before we close our session, we would like to open the participant. Is there any questions to Dr. Aidil regarding the topic that we have discussed? Okay, there's one question from Dr. Hanani. Assalamualaikum, Dr. Aidil. What is the minimum number of reviewers for both scoping and systematic review? Okay, please welcome Dr. Aidil to answer the questions.
Okay, I'm again, I need to admit I might not be expert in the field, but I just have experience conducting this. So from my understanding, at least you need to have 2 people reviewer. Based on my reading, towards multiple systematic or systematic review, normally they provide about 2 to 3 reviewers. That's from what I actually understand.
Okay. So thank you. Okay, there's another question from Dr. Zul Faizal. Okay. Assalamualaikum Dr. Aidil. Can we replace literature review section in PhD or master thesis with scoping review?
Okay, that's a good question lah. It's not a straightforward answer. It can, but maybe my advice lah to supervisors, if you like to consider for your students to publish or to conduct a scoping review, my suggestion is that you need to consider that to be part of the study objective, because the amount of work is quite significant. So because I come across in certain situation whereby the students, especially for master lah, for PhD, maybe different story. I have experience whereby the students actually conducted systematic review or scoping review. At the same time, the student also have few experimentation, maybe 3 or 4, something like that. So I think it's quite a burden for the students to have 3 experimentation plus another scoping review. So my answer towards that, it can be done. From my understanding towards the PD policy, there are no clear mentions about whether we can actually, maybe not eliminate the literature review section, but perhaps to come up with a scoping review to replace that particular literature review section. Maknanya the literature review section is covered by the scoping review. Okay. But again, it depends on examiner as well lah. Itu pun memegang peranan.
Okay. So we have a lot of questions coming in. So Dr. Aidil, please prepare to answer. Okay.
InsyaAllah.
Dr. Firdaus, okay, looks like some people, some of our participants have interest about this topic. Okay, so a question from Dr. Firdaus. Dr. Firdaus said, great talk to Dr. Aidil. So in a short explanation, if you may, what entails a meta-analysis?
Meta-analysis normally is referred to analysis whereby we combine all the findings from across papers. So that is, I would say, meta-analysis. And normally people associated meta-analysis with at least a statistical analysis. Maknanya, besides you are combining papers, you also need to analyze the data across all of the papers. Normally what happens, they take the mean of the data from each of the paper and sample size, as well as the standard deviation, and they will actually make a comparison across the paper.
Okay. So from Dr. Siti Nurkhairina, I guess she is from Kuliah of Nursing. What is the duration that is relevant to perform systematic review? Is it between 5 or 10 years? Okay, please, Dr. Aidil.
Okay. From my experience, normally people will try to do as recent as possible. And in terms of the duration, it actually depends on field and also the topics. Like I mentioned, some of the topics may require as early as possible, as earliest as possible. But some topics whereby we have really clear in terms of when actually the starting point of that particular research. Maybe we can have a starting date. And at the same time, there are also situations whereby there are systematic review or scoping review has been done beforehand. Maybe in that sense, you need to also consider whether you want to be part of a continuation from the previous systematic review. If you are continuing from the previous systematic review, maybe you should actually select the date of the last review by the previous paper. And until recent. Maknanya the recent tu maybe now is 2021.
Okay, we have another question from Dr. Moy, our kuliah, Life Sciences. So, good afternoon, Dr. Aidil. What criteria are used to determine whether the paper is a quality paper?
Okay. Actually, there are tools available. Maybe this is referring to systematic review. So basically what happened, there are tools available. They will ask the assessor, those who actually familiar with research design, to actually make a judgment towards each of the papers. Among others is whether the papers mention clearly about the research design, whether there are random assignments towards subjects, whether the sample size are adequate. So that is part of the quality assessment, and there are tools available, a lot of tools available. I actually using Crow Critical Appraisal Tool 2012. So that is the one that I'm familiar, but I know there are a lot of others critical appraisal tool that are available. So using that particular tools, they will come up with certain percentage, and certain tools they maybe have different criterion. Maybe some tools they just pass and fail. So this is pass, so you can include. This one fail, you cannot include.
Okay. Okay. Another question from Associate Professor Dr. Muzaffar from RMC Kuantan. Assalamualaikum Dr. Aidil. Which type of review carry the most merit to authors in careers?
In careers, aduh, sorry, but like I said, normally high impact papers, they are looking towards systematic review as well as scoping review. So what happened, this is my own experience. I have submitted narrative review papers to one of respected journal in audiology. So it was desk reject at the level of the editor, because the editor said our journal only accept systematic or scoping review. So in other words, yes, if you asking me about which review that we should consider beneficial for our career, perhaps the systematic or scoping review.
Okay, so the question, we have question coming in. Okay, it's from Dr. Norafiza Zainuddin. What do you think having undergraduate students as the reviewers for bias analysis?
Okay, ni memang betul soalan normally being asked lah to me. Actually, for bias analysis or quality assessment, normally it should be done by expert. Because undergraduate student, from my understanding lah, ataupun from our understanding, they are still learning. So obviously they are not really expert in that particular field. But what happened, somehow I do understand that supervisor somehow have limited time to actually work with the student. But my always suggestion to the student is that you might do it yourself, but whatever it is, your supervisor need to verify. Your main or maybe co need to verify your works. So that's maybe the best option that we can actually suggest lah.
Okay, so we have question from Dr. I don't know whether doctor or sister, Dr. Nurul Ashikin Yusof. Assalamualaikum Dr. Aidil. Do we have minimum numbers of literature in systematic review?
From my understanding, minimum 2.
Okay.
I have experience published 4 papers included in the systematic review, but from my understanding, minimum 2.
Okay, thank you, Aidil. So from Sister Nur Sabrina Sulaiman, this is optometry postgraduate students. She said that I did scoping review, as you said, brought source to search the journal. Is it one source enough actually? Because when from too many sources, I get so many paper that I need to filter. So what do you think, Dr. Aidil?
Okay.
Is it one source enough actually?
This is tricky question lah. Like I said earlier, I come across 1 or 2 studies whereby they're actually using Google Scholars alone, and they compare with multiple database. So actually, Google Scholar did not miss any papers from all of the database, reputable database like ISI, Scopus, PubMed, or ProQuest, so they're not missed. But as a matter of fact, somehow some journals, they would like the authors to have at least 3 to 4 database. So if you are relying on one database, the issue is that maybe you tend to miss certain papers. Although if you are using even 4 or 5 database, there are still a tendency you're going to miss. but at least we try to minimize the tendency to miss the papers. So I think that's the main reason lah. In terms of works of filtering tu no option lah sebenarnya, because that is actually the difficult part of doing a scoping review. But maybe I just want to share my experience, what happened, especially in situation like this. Our library, bukan nak mengutuk our library, but somehow we have limitation. Our library, even we don't have ISI, we not subscribe to certain database. What happened, somehow I always hire students, undergrad students, who actually in summer break holiday in Australia or UK. I give them maybe about 500 ringgit, and I teach them on how to search, and they will do it for me. But you need to really train them and ask them to provide really detailed information that you actually need from the databases. So that's maybe something that you can actually do.
Okay. So question from Dr. Mehrandola. So we have questions coming in.
Itulah,
What
maybe
is
we
the
need a
difference?
workshop kot ni, Dr. Hafiz.
Yes, I think since we have many feedbacks, I think we can have sort workshop in future, inshallah. Okay, from Dr. Mehrandola, what is different between bibliometric analysis versus systematic review? Bibliometric analysis versus systematic review.
Actually, I'm not really familiar with bibliometric study. Somehow, by its name, it looks like the same, but I'm not sure in details on how actually we conduct a bibliometric study. So I cannot answer. I'm sorry.
Okay. Okay, since this is from Dr. Nur Fatiha, I think a similar question that has been answered by you. Assalamualaikum Dr. Aidil. What is the minimum number of what is the minimum number to review the articles for scoping or systematic review?
I said in terms of the final outcome to 2, but in terms of numbers of the search article it depends on your search lah. It can be 2,000, but somehow itulah we need a really proper training, because somehow we need to really strategize in terms of the hit rate, in terms of searching. Kalau boleh we try to avoid to have really high hit rate like 15,000, because you need to filter many papers. So kena ada balance in terms of we have a minimal hit rate, but at the same time we don't miss any papers. So that is something that we need to learn from each other.
Okay. So this is from your colleagues, Dr. Aidil. The question, Dr. Sarah Rahman.
Okay, yeah.
Assalamualaikum Dr. Aidil. I normally have problem publishing scoping review because of the length of the review. Normally, we gather around 200 plus papers, and the table of findings could be quite lengthy. Any trick on how do we go about this?
Trick tu tak ada sangatlah trick, but somehow we need to be really selective in terms of putting the references as well as the table. We might need to consider to put that as a supplementary materials. So I think that's the only option that we have. In fact, in some of the scoping review that I can come across, they even did not put the references in the reference list, but they put it under supplementary materials. That's maybe something yang no option lah, especially when we talk about the high impact journal, 3 point something, they have some limited number of pages that they allow.
Okay. So again from Dr. Nora Fiza Zainuddin, what about publishing a systematic review without meta-analysis?
Can be done. Actually, I have experience doing that. I just using a descriptive analysis. Actually, it depends on the objective and depends on the available evidence. Like in my case, what happened, I only have 4 papers that time, and I don't find using meta-analysis using like effect size can actually help us to come up with the final conclusion. So I have decided just to use a simple descriptive analysis, just to say that out of these 4 papers, 3 are showing a positive finding, 1 showing a negative finding. Very simple. So it's possible. But again, depends on the reviewer of the papers as well as of the journal itself.
Okay. Okay, from Dr. Hanu Yaakob, Assalamualaikum to Aidil. Is there any tips on determining the right keywords should be used in searching for previous literature? Is there any
maybe a short tips that I can share. So normally when we are doing scoping or systematic review, we have some sort of publication or journals that we have in our list. Maknanya we have actually come across or read the papers, maybe 10, maybe 20. So what happened, I normally do some sort like pilot search using certain database. So I'm using that particular keyword and I try to see using this keyword whether I able to get that particular 20 articles that I have in my hand. So that's maybe one option. And I also try to see the hit. So I try to compare using this particular keyword, how many hit that I have and whether I can retrieve back that 20 papers. So my target is that to get less hit as well as the 20 papers. Maybe that's the tips that I can actually share.
Okay. Next question from Dr. Farah Waida, our colleagues from Allied Sciences. Assalamualaikum Dr. Aidil. In your opinion, can undergraduate embark on systematic review, or would it be a burden for them?
Okay, good question. During pandemic ni, I would say maybe we should answer yes lah, because somehow there are concern whether our FIP can actually go to clinics and somehow it can affect their performance. Cuma I think in terms of guidance lah, we need to give a proper guidance to the students. That's all. I think they can actually conduct a systematic review, and somehow depends on the guidance and student itself juga lah, because I have experience even we provide proper guidance, students doing everything last minute, obviously the outcome will not be that good lah. I have experience whereby I need to redo all over again to publish because the student miss certain things. So for FIP, I would say okay, they might pass the FIP, but if they're not doing correctly, you might not be able to publish. That's all lah. Dia punya after effect.
Okay, so from Dr. Nur Fatihah, how many assessors should assess for the quality of paper review? I think you have answered it.
2 at least lah.
Okay, Dr. Afzarini, there are many guidelines to conduct a scoping review. Which one is the best?
Okay, actually Dr. Afzarini ni pun expert in scoping review and systematic review. Tak tahulah sebenarnya betul soalan ke apa je. Tak adalah, saya gurau je Dr. Af. So far from my understanding, scoping review according to Dr. Af ni soalan.
Yes. Scoping.
I would say sebenarnya even if we can actually select any of the framework, but from what I come across, even if you select the recent one like JBI, they are using the original AXI at MACLI 2005 guideline. So I would say we can use any types of framework lah. Maybe there are pros and cons between all of the framework, but so long as we are following the framework, should be okay. That's from my perspective lah. Someone who not really expert juga lah in scoping review, but that's from my perspective lah.
Okay, question from YouTube, Dr. Aidil. What did you expect of the library services for finding articles? What did you expect of the library services for finding articles?
Okay, what did you expect of the library services for finding article? Okay, from library sebenarnya kalau what we expect from library, obviously if they can provide or subscribe more database will be better lah for us. That may be one thing. Second thing, if library can provide a training or subscribe to certain software related to systematic and scoping review like Covidence will be great, I think. Subscribe and later on provide a training to the researcher. So if the researcher can have that particular skill, I would say many of us will be able to publish scoping and systematic review in very efficient way lah.
Okay, inshallah. Okay, this is from our colleague as well, Prof. Dr. Suzana. Assalamualaikum, Dr. Aidil. Thank you for this refresher course on systematic and scoping review. What do you think would be useful skills acquired by undergraduates in hard sciences field when they do systematic or scoping review in their final year project?
Okay.
How would this prepare them after they graduate?
Okay, this is high level question. What do you think will be useful skill acquired by?
Can I repeat the questions? What do you think would be useful skills acquired by the undergraduates in hard sciences fields when they do systematic or scoping review in their final year project? How would this prepare them after they graduate?
Okay, from my perspective, there are a lot of skills that they're able to learn in the scoping and systematic review. First, in terms of searching, in fact, they need also to learn in terms of analysis of the papers, for example, like scoping review, how to do the thematic analysis. So that also needs a certain skill. But maybe some limitation from my observation when FIP students to do a systematic or scoping review is in terms of their understanding towards certain articles. I think this one need really a proper guidance from the supervisor, because you understand that they are actually still learning. They are learning about optometry, they are learning about audiology. So when they are reading an article, their level of understanding might not be as similar as the supervisor, even as not as similar as our postgraduate student. So our postgraduate student is a mentored student, and they have, some of them have practiced as an audiologist or optometrist. So this is something that from my observation, our undergraduate students struggle at. But the good thing is that they will be able to read more papers related to that particular field. So if they be able to simplify or understand certain articles, I would say that is really a bonus or extra additional skills for our FIP students, because once they're graduated, they some sort have really good understanding in certain areas, certain topics, because they do a lot of reading. But at the same time, it depends on the effort of the student, as well as how the student engage with the supervisor and how the supervisor actually provide feedback to the student. So this actually will determine the final outcome of the FIP.
Okay. This question from Dr. Nora. Well, a lot of questions for you.
Itulah, tak
Okay.
apa.
Okay, Dr. Nora, Assalamualaikum, Dr. Aidil. Can we include grey literature in systematic literature review or scoping review? I repeat the question. Can we include grey literature in systematic review or scoping review?
In general, yes, we can include grey literature in both scoping as well as systematic review. But for systematic review, it depends whether the grey literature is relevant to the inclusion criteria. Normally, grey literature we obtain from library or documentation that cannot be accessed using database. And in certain situations, we have searched everywhere. We cannot find the paper, but our friends who are expert in that particular field, they'll be able to actually supply that article to us. So that is considered as a grey literature.
Okay. Okay, there's a final question from Dr. Azahri.
Dr. Saadah ni, okay.
Saadah kan? Okay, Dr. Saadah kan? Okay, Dr. Saadah. Scoping review does not need to do assessment quality of each paper. Am I right? What about prisma analysis?
Okay, this is from my understanding lah. From my understanding, scoping review doesn't require any quality assessment. Prisma analysis, I cannot actually recall exactly, but normally prisma analysis being used for systematic review. But maybe I come across there are also guideline from Prisma on scoping review. But I don't think even in the guideline to mentions about the need of quality assessment for scoping review. That's from my understanding.
Okay. So okay, this is I hope this is very final question from the participants. It's already past 10 from 4. Again, 10 past 4 actually. So Dr. Mardiati, Assalamualaikum Dr. Aidil. Okay, hope this is final questions. So we want to close this session. Inshallah, in future, since the what you call the sambutan is very good, I think we can have a workshop in future, right? Maybe 2 days or 3 days workshop. Okay. Assalamualaikum Dr. Aidil. Is there any tips to turn literature review section in thesis to scoping review?
Okay, this is also tricky question. Depends sebenarnya if the students actually track down all of the details during the searchings of the papers, when the students actually conducting the literature review, that can be done actually. Maknanya the student really documented on the keywords that being used and what database that they search. If we have that kind of information, yes, there are possibility to turn the literature review to a scoping review section. But if without the information, I would say difficult, but you can actually do the search again and then come up with the scoping review. Maybe lah one last information about this scoping review ni, dia simple je analisis dia sebenarnya. If I can share, Dr. Hafiz.
Yes. Sure, you can share.
Yeah. This is one, boleh tengok boleh nampak. This is one example of papers. Okay, this is the result section. Tapi bila kata senang tu tak adalah kata it's very easy. Oh, bukan this paper, maybe another paper. Sorry. I need to put another one. Boleh nampak ke paper background sound ni ke paper lain ni keluar? So actually kalau tengok sini kan, boleh nampak ke hearing aid technology sini ni?
Yeah, sure, Dr. Aidil. Please proceed.
Ada keluar kan Dr. Hafiz, hearing aid technology over here?
Yes, sure. There is a presented.
Okay, so according to this PDF ni, so this is the themes obtained from across the paper. So 35 papers talking about this hearing aid technology. So this is the result that being obtained by the authors. So okay, and then 8 papers talking about this particular aspect, acclimatization. And 9 papers talking about non-auditory influences. So that is very simple je lah sebenarnya. The scoping review ni punya method is just to map the findings, find across all the papers berapa banyak papers talking about these topics, berapa banyak paper talking about this topic. Nampak macam simple lah, but that is the general idea about scoping review.
Okay. So I think that's it from for the Q&A session. We have a lot of questions. I didn't expect that we will get many questions, and means that the feedback is very good. So I think in future we can collaborate with RMC, Gombak, and Kuantan to organize this systematic review workshop. Maybe you will maybe how long it will take to conduct the workshop? Maybe 2 days or 3 days?
Maybe 1 to 2 days.
1 to 2 days.
And maybe we also need other expert. I know that I'm not saying I'm an expert, but there are a lot of other people that also doing systematic and scoping review. Maybe we can call even from our kuliah, macam Dr. Af, and there are a few others who are actually good in terms of conducting systematic and scoping review. Maybe we can combine our effort together to come up with a good module lah for scoping and systematic review.
Okay. So feedback from Dr. Adina, RMC Gombak. Thanks a lot, Dr. Aidil, for the insightful sharing. A hands-on workshop on doing this review in the future is indeed wonderful. Maybe after the workshop, participants can attempt to publish the work. Inshallah, Dr. Adina. So I think, Dr. Adina, we can collaborate from HOR KAHS office and the RMC. Inshallah, in future we can collaborate for conducting this workshop, 1 or 2 days workshop. Okay, so without further ado, we would like to close our session with Tasbih Kifarah and Surah Al-As. Okay, thank you very much, Dr. Aidil, and thank you very much to all participants joining this program. Inshallah, we will have another pitching talk 3 months from now. Thank you. Assalamualaikum warahmatullahi wabarakatuh.